I think the transformation programme is really important because it has tried to embrace the idea of the best change is often an idea that comes from the front line, and they have recognised that. They have recognised that sometimes bringing someone in from outside who doesn't understand the organisation can set up all sorts of difficulties, because you have to bring people up to speed with the knowledge in the organisation before you even start anything. So what this transformation programme is trying to do is use skills, enthusiasm, energy that's already within the health board. I think the way it's been set up is actually visionary. I think it's a really good way of doing it. Also, we have a limited amount of resource, whether that be staff time, estates, money, and we have to get really quite clever about how we use that. I think the role as Assistant Clinical Director of UHL is a huge opportunity to actually get to know people, to find out what people are doing in terms of transforming services across the UHL site. I think there is huge opportunity on that site for clinical boards to work together, for teams to work across kind of traditional boundaries to see how we might make things better for people. That's the real excitement for me, is we actually might be able to, in a very patient-centred way, support staff themselves to develop and change services to improve them. I've had a real opportunity already to meet with some of the people on the site, and what is quite moving, I think, is when you talk to people on the front line, the majority that you meet have a real passion for what they do, deeply committed to delivering good services to patients. Often very frustrated about some of the boundaries they perceive and some of the obstacles to improvement. I was lucky enough to go around some of the medical wards already with some of the staff, and was just really impressed by what I saw. I think there were real opportunities to harness some of that enthusiasm and passion and really just help them think through how we might improve things. The good ideas will come from thinking boldly, thinking creatively in your teams, right in front of the patient, you know, close to the patient. Because I might have what I think is a tremendously good idea, and it just won't work, because it won't work for the patients and it won't work for the staff. So I'm very keen to encourage creative thinking. If when we sit down we just think, you know what, this really won't work, and then we go, right, let's think of something else. I know that the transformation team are very keen to support that as well. I'm very keen to say, let's be brave, let's look at it, let's think about how it might work, let's sort of suck it and see, if you like, do a little pilot maybe, and then if we think very quickly, this isn't going to go, then that's fine. My role is very much about wanting to support the UHL staff to think like that and to think creatively with their service users and patients and carers as well. We mustn't forget them, because they'll probably have good ideas that we could use. I think this is a huge opportunity, and I'm really excited about doing this work, so I'm really looking forward to the next weeks and months of learning more about UHL and knowing more about what we can deliver and how we can take part in the transformation agenda as a whole. It's going to be very exciting.